Welcome to our new series of What's Your Focus. In our series, we cover our current issue and we portray our guest editor, who in our current case is Professor Alicia Morgans, who is a medical ecologist from Dana-Farber Institute at Boston. Welcome, Alicia.
Thank you so much for having me. It's really quite a pleasure.
So first of all, thank you for working with us. You put together a brilliant issue on prostate cancer survivorship. I think our audience would like to learn more about yourself and your specialty. Maybe you can just give us a summary of what you're doing and what your interests are.
Sure. So I actually serve as the medical director of the survivorship program for Dana-Farber Cancer Institute. So covering cancers across the spectrum, including hematologic malignancies, which is quite far afield from the things that you and I do day to day when we care for patients with prostate cancer. But luckily, I think that this exposure has helped me to gain even more understanding of our own patient population and to think a little bit more broadly about the issues that may interact with and interfere with the survivorship experience of patients with prostate cancer. Using that, I really tried to think very broadly about what topics may be of interest to patients and their clinicians, the ones who are caring for them day to day as individuals are trying to get through, past, and even live with a diagnosis of prostate cancer as survivors. And I think to that end, we've been able to include multiple things within this issue, including the standard complications of androgen deprivation therapy and radiation, but also thinking broadly about diet and lifestyle, exercise interventions, and really trying to incorporate the entire gamut of what might be important to individuals living after a diagnosis with prostate cancer.
Fantastic. I guess, I'm sure our audience will be heavily interested. Maybe to pinpoint that, you mentioned already intermittent hormonal treatment with regard to cardiovascular dysfunction. Maybe could you summarize in 1 or 2 words? I think you have a debate here, which is highly interesting. Is there anything new that we can give as a message for our audience?
Sure. So I think the most important thing here is that we have people coming down very strongly on either side of this debate. Some saying that intermittent therapy actually is associated with higher rates of cardiovascular dysfunction, and others who are saying that it might be related with less. And certainly thinking about things like using the therapeutic choices to limit our cardiovascular risk in patients. I think that's relatively well agreed upon between the sides. But new information and some old information suggests that intermittent therapy may be associated with more cardiovascular risk. Perhaps it's that off and on of FSH, LH, testosterone surges, and other factors that may be contributing. And I don't know that either side really came to a conclusion here to definitively say what is best for every patient, but I think the conversation is one that is worth having. The other thing that I think is important to recognize is that although we have had one study, at least, with a cardiovascular primary endpoint, the PRONOUNCE study, to try to understand whether GnRH antagonists may be associated with less cardiovascular risk. Unfortunately, that study never really answered the question because, of course, it was under-enrolled and then had an event rate that was far less than was expected. So this question of intermittent therapy, cardiovascular risk, GnRH agonist, antagonist, this is all still out there. And I think a really prime place for our community to continue to engage, investigate, and try to make some advances.
So the debate will be going on. I think one other topic, which is very interesting, is about nutrition, because I guess that's we're being asked every day by our patients about that topic. Can you enlighten us a little bit on what you're putting on in your issue? Is there anything new with regard to that topic?
Sure. I think what's nice about this topic is that this was really a review of data at its most recent update and really trying to review the information that we have and highlighting areas where we still need to continue investigation. Every other week, a patient comes into my clinic and says, I need to do the keto diet, or I need to do the no sugar diet, or this diet or that diet. And people feel very, very committed to these different diets. But ultimately, at this point in time, there is no diet that seems to be the perfect tried and true anti-prostate cancer diet. But what I like about the work that was submitted is that it really tries to at least characterize the data as we have it, give best suggestions, and encourage patients that this does seem to be something that patients feel really empowered to engage in. And we should always encourage our patients to make smart decisions and to do what they can for their overall health, cardiovascular health as a main point here, and really take that active role in their prostate cancer journey.
I couldn't agree more. I think being active yourself as a patient is really important for our patients to contribute to getting better at a certain point. Interesting. I guess my last question is about exercise. Something else that I think we maybe don't put enough focus on, because I think we could do more depending on the stage the patient is in. So what's your view on that?
I think that exercise can really have so many benefits beyond simply building muscle, because it does release endorphins, helps individuals have a positive worldview. It improves their mood, their energy levels. And when people are on androgen deprivation therapy, this can be extremely powerful. So from a physical and mental perspective, I think that exercise is really quite a healthy thing. And this was something that was also outlined and really highlighted in this edition, the survivorship edition of European Urology Focus. One thing that I think is so important is that this is also an area where patients can be empowered to engage, to take that first step. And it is actually so helpful when clinicians say, I recommend this for you, because sometimes that really definitive counseling and very clear statement of recommendation is all that an individual needs to continue to make the next step and the next step and the next in order to engage in physical activity, which really has, as I said, so many benefits.
Alicia, thank you so much. I think you brought to our attention a lot of aspects that we take care of every day. It is really worthwhile reading your issue, and we look forward to getting new aspects as time continues. Thank you very much, and I wish you all the best for your future careers. See you soon.
Thank you so much.
Thanks.